All right, so we'll go ahead and jump right into things. Good morning, everyone. I'm glad you're here this morning. I know calendars are full, and choosing to spend 90 minutes together is a meaningful commitment. So, thank you very much. I'd like to introduce myself. I will be your host for this learning series. My name is Veronica Farias. I work for Thriving Together NCW as a Director of Network Development. And my role is to connect organizations to foster collaboration and strengthen community partnerships to advance the vital conditions for health and well-being across North Central Washington. If you aren't familiar with the vital conditions framework, don't worry, we will cover a quick overview of the framework. And of course, given today's session, you will certainly get exposure to basic needs for health and safety, one of the seven vital conditions for health and well-being. So before we dive in, I'd like to invite you all to take a deep breath, settle in where you are, and arrive fully, not just as professionals across our region, but as people who care deeply about our communities. And selfishly enough, this breather is actually for me because it's been a long morning already. All right, Sarah, let's go ahead and take it to the next slide. So I'd like to welcome everyone to share your name and your organization in the chat so that we know who you are and so others can see who's sharing space with them today and maybe where you're tuning in from as well so that we know where you're coming from. So here's a quick look at our time together this morning. I will move into providing an overview of the vital conditions framework um, and basic needs for health and safety before hearing directly from those doing boots on the ground. We have lined up some amazing partners, including Kat from Room One, Stefani from Thrive Chelan Valley, and Derek from the Aero Methow Rescue Service. We will jump into small group discussions to help us with some sense making. And we will reconvene as a large group with some reflections and takeaways before wrapping up with some network updates and a sneak peek at what's ahead. Next slide, please. So today's session is part of our network learning series focused on the vital conditions for health and well-being. The goal for today's session is to not only highlight how partners are leaning into basic needs for health and safety, but surface shared challenges for better understanding. We hope that you learn through these stories and partnerships, and ultimately that this sparks some connections and opportunities across the region. Next slide, please. So I promised I would offer a quick overview of the vital conditions framework. The vital condition framework helps us name the shared conditions that communities need consistently and equitably so people can thrive. By definition, the vital conditions are the properties of places and institutions that we all need to reach our full potential. Rather than focusing on individual programs or sectors, the framework helps us look at the ecosystem. So, how systems, how policies, how relationships and services work together or sometimes don't to shape the outcomes. It gives us a common language to see connections across health, education, safety, housing, and economic stability. Next slide, please. So today we're focusing on one of those vital conditions, basic needs for health and safety. This refers to having reliable access to the essentials that support physical and mental well-being, creating security and the foundation for people and communities to thrive. On the surface, this can sound straightforward: food, water, sleep, safety, care, etc. But what we know is that when these needs are unmet or fragmented, everything else becomes harder. Next slide, please. So what you'll hear today are not only isolated programs within organizations, but different entry points into the same vital condition. From direct services to prevention to emergency response, each reflects how different sectors are holding pieces of the same foundation, often responding to the same root challenges just from different angles. So basic needs are also where systems most clearly intersect across health, across education, housing, emergency response, food access, violence prevention, and even youth development, which is exactly why this conversation matters and why you're here today, accompanied by these amazing partners. Next slide, please. So we're going to kick off our first speaker. Will be from the Aero Methow Rescue Service. We'll hear from Derek, and he's bringing in the emergency response and health safety lens. EMS is often where gaps in the system become most visible when basic needs, access to care, or prevention efforts haven't fully aligned. So I encourage you to listen for how emergency response, injury prevention, and community paramedicine contribute to safety, not just in crisis, but throughout some of their upstream efforts as well. Thank you, Derek, for joining us, and take it away.
Great. Well, thank you, Veronica. Thank you, Sarah. I'm honored to be here this morning and share a little bit of time with you all, not just about what we do and educating you all about that, but also learning from our other presenters and the other people participating. Go ahead to the next slide, Sarah. So what I want to cover this morning is a little bit about what we do and how that connects to the vital condition that Veronica was just describing, who we are, who we see and where in the communities up here in the Methow Valley. Take a look at our historic call volume, tell you a little bit about how we're funded, and then some of our future needs. And there I'll talk a lot about who we partner with here in the Methow as well. Next slide. So obviously we provide 911 EMS response to people who need it here in the Methow Valley. Of course, each one of us who live here in the community depend on Aero Methow every single day. We just don't actually know when we're going to need them. So we provide 24/7, 365 days a year, advanced life support care. We're quite far from any other hospital, and so the primary service that we're providing is responding to people who need us in time of care and responding to them, stabilizing them, and getting them to the next level of care. Our response area is quite large. It's in the map down there on the right. It's 2,000 square miles. In general, it goes from just south of Carlton all the way to the Canadian border and then up to Washington Pass. In addition to the EMS service that we provide in the Methow, we have a number of community programs. Those are listed down there, but in general, some of the big ones, Stay Active and Independent for Life class, which keeps elders moving in our valley. There are some other partners here in the valley who run those classes as well, like Methow at Home. We do first aid, CPR, and AED training, check child passenger seats for proper fit and safety, and we have a helmet safety class that we do as well. Next slide. As I mentioned already, we are an advanced life support agency. We have 5 of those big type 1 ambulances, which are basically ICUs on the road, and 7 quick response vehicles that we are able to deploy throughout the valley. We have 16 full-time and part-time staff. 2 of those are admin, 7 medics, and then 7 advanced EMTs and EMTs. And we have a huge dependence upon our volunteers, 25 of them currently. We also have 6 students in an EMT class now. Our volunteers in 2025 donated over 16,000 hours to our community. So it's a huge dependence on them and allowing us to provide 24/7 advanced life support care here in the Methow Valley. And then we also have 8 board members. Next slide. So just some quick numbers, touch points from 2025. 911, that's not 911, that's just symbiotic, 911 emergency responses, 13 helmets fitted and distributed to some local youth here. 19, I talked about that sail class. They're at 19 active members in the one that we run, and a number of others through Methow at Home. We had 37 local agencies participating in CPR and first aid training here in our training room, and taught 245 local people how to do American Heart Association CPR and first aid. And that last one is really important to us because, as I mentioned already, we have long transport times and a huge valley, a service area. Oftentimes, particularly in cardiac arrest or in heart issue calls, if someone does need CPR and it takes us 15 to 20 minutes to get there, we really depend on those first responders in the community to start CPR until we can get there and take over. So we're proud of everyone who goes through our local CPR first aid classes. Okay, next one. A little bit about who we see and where. I talked about the big service area. The bulk of our patients are Methow Valley residents, almost 80%. We do get a lot of visitation here, and consequently we see non-residents, but not as many as some might think. So the bulk of our patients are people who are actually living here and depending on us. And similarly, the bulk of our calls are actually in what I'll call the sort of Central Valley area, which is Winthrop and Twisp. Almost 90% there, and then the Mazama and Carlton, sort of the outlying areas. There's some wilderness area in there as well that we respond to, hikers, skiers, things like that. But again, the bulk of who we're seeing is on the valley floor in Winthrop and Twisp. And then about our call volume, and this one's important. The blue bars are transports, the orange bars are non-transports. Together, they represent our call volume. Just in general, you can see since 2017, our call volume is steadily going up. We don't see a change in that anytime soon. And then next couple of years, we predict it will be well over 1,000 calls a year, which is roughly 3 calls a day. More significantly, rural EMS is largely dying across the country, and it's because EMS was built on transporting people. And as you see, our non-transports have been on the rise, and anytime we go on calls and treat people, maybe even stabilize them, but we don't transport, there's nothing that we get reimbursed for in there. Next slide. We typically, this is 2025 call volume. It mirrors what we see again for the last 10 years, essentially, that by around April, our call volume will spike. It stays pretty steady and high through the summer, and then starts to drop down and plateau through the fall and winter months, but not as far down as when we in the first quarter. So our first quarter is typically our slower call volume, where we're at right now. So we see this trend, have seen it in the last 10 years. We expect it to be the same, but the overall line graph will just keep rising as our call volume goes up. Next slide. Just in terms of types of calls, a lot of people think most of our call volume is trauma. It's not. It's actually medical. So this is out of those 911 calls last year. Over half of them were medical issues. And again, because we're that ICU, advanced life support bus on the road, this is really important for people having serious medical emergencies. We do see a fair amount of trauma, but not nearly as much as medical, and that matches again through the last 10 years. The others are numbers of that 911 that included some fire standby, some event standby, canceled en route. There's a lot of reasons for that. And then just a handful of going on arrival. Next slide. As I mentioned earlier, we are an EMS across the nation is only paid to transport. So anytime we roll out, obviously it costs to have everything ready. It costs in salaries, it costs in fuel, it costs in supplies and equipment and training for that matter. But we don't recoup any of that cost unless we are transporting. There's a lot of efforts underway to try and change that. But it's important for everybody to realize EMS across the nation is only paid to transport. We do have an EMS levy here, both towns and the unincorporated areas. That covers about 60% of our operations. And the reimbursements we do get for transporting covers about another 25%. And the remaining 15% we have to fundraise for in order to keep going. Just in terms of our community connections, again, coming back to that vital framework, some of the things we're looking at into the future, we're contemplating and trying to push forward a community paramedicine program. We're currently working with, I'll drop a few bullets down, an elder care coordination network that includes Room 1. You'll hear from Kat in just a little bit. It includes Methow at Home, who I've mentioned a couple of times, as well as Jamie's Place and a few other partners. And in that network, we're trying to connect people who need additional care. And in our case, hopefully keep them, if it's not an emergent situation, out of the 911 system. So using the community support here that will that provides the services that those people need and may not be just 911 calls. In sort of similar to that, the community paramedicine program tries to do the same thing. There are several that exist across the country and even here in Washington State. And in general, what they do is use an EMS service to provide follow-up care, in-home care, treatment in place, possibly post-op follow-up, lots of services that someone without any other additional help may end up just calling 911 because there's no one else for them to go to. So we're looking at a community paramedicine program, and again, that dovetails really well with the current elder care coordination network that we're presently operating in. This year, we're looking at fully staffing a second ambulance as well to maintain that ALS service throughout. Typically, what happens is we have a crew on, which is happening right now. We have a crew or two who are out on calls, and then we staff up the next ambulance. I'm currently ready to go for the next call if it comes in, so I apologize about that if I have to leave immediately. But we're looking at, in our higher call volume times, we're looking at making sure we have that second crew already on staff. Also, our injury prevention and education, as I mentioned earlier, gives us a lot of touch points in the community, both to train people as well as to help educate some of our members in the community on what exactly Aero Methow does, who's there, and how we can help them. And then lastly, we launched a podcast this year, the beginning of this year. It's called Between Here and Help. And we are sponsoring that podcast, but the person who is doing the podcast is interviewing a lot of the partners in this healthcare network, the ones that I mentioned earlier, as well as others like Life Flight, Airlift Northwest, the hospitals, just to give people a sense of like, how are we all connected and what are the different roles and how do we coordinate with one another? And it's supposed to be from sort of a lay person's point of view. You can If you're interested, search for that pretty much anywhere you listen to podcasts. And there are new episodes that drop on the 15th of every month. And I think with the last slide, I'll just wrap up and say I really appreciate everybody's time and listening this morning, and I look forward to hearing the next two presentations as well.
Thank you, Derek. That was a great recap of Aero Methow Rescue Service, and thank you for all that you do up in your neck of the woods. All right, so next up, we will hear from Kat from Room 1. Room 1's work sits right at the intersection of direct services, prevention, and advocacy, which is a powerful example of how basic needs for health and safety show up across the lifespan. As you listen, I invite you to notice how Room 1 addresses not just immediate needs, but also freedom from trauma, violence, and instability, and how relationships and community connection are a part of that safety net. Kat, take it away.
Thank you, Veronica. Good morning, everybody. My name is Kat, and I use she, her pronouns. I'm the executive director at Room 1. Thank you for the invitation to join you all today for this learning session. And like Derek said, I'm excited to learn together. So, can go to, yeah, there we go. Okay. So just a little information about Room 1. We're a community-based nonprofit in Okanagan County in the Methow Valley. And our mission is at Room 1, we recognize and use the power of community to create connection and work towards positive change. Like Veronica said, our 3 pillars of work are our direct services, our prevention, and then I wrote advocacy on the slide. We're trying to change that language to systems change. While I could, I could give examples of how all 3 of these areas of work are connected to the vital condition that we're discussing today, I'm going to focus mostly on our direct services. But I think my invitation is that if you hear, as you hear some of the stories that I share, you can kind of see how all these 3 pillars of work are interconnected with each other. So this is just an image of kind of our theory of change, and again, how all of these pillars of work relate and connect to each other. So our direct services have have been, a core part of our work since we were founded in 1998. And just kind of what that looks like. We have client advocates who meet one-on-one with individuals and families in our community who are seeking assistance for themselves or loved ones. And for us, working with someone is just that, we're working with them. So we listen, carefully to their situation, kind of work with them to outline the best path forward for what's happening in their life. And the requests that we receive are everything from, well, they're very related to many different kinds of basic needs like housing, utilities, safe shelter, food, transportation, legal resources, mental health, support with addiction, and many other things as well. So we can go to the next slide here. So I took this quote from Thriving Together's website and the description of the basic needs for health and safety, vital condition, and we certainly couldn't agree with it more. I put some pictures of food on here because one of our programs within our direct services is our food access program. So we buy fruits and vegetables and protein from local farmers, and people can come into our office and take what they need. we do have a great food bank here nearby, but this is just kind of a helpful supplemental thing for people, and it makes it really easy if somebody's coming in for some other service, they can grab a bag of carrots and apples on their way out. It's very low barrier, available whenever we are open, and there's no eligibility requirements for anybody to access this produce or protein. So in 2025, our food access program distributed, approximately 2,500 pounds of produce. And then even in just December alone, we distributed, I think, 73 pounds of protein. So the food access program has been, we've been in the last year, we've been seeing a lot of activity with that program just because of changes with WIC and food benefits and the pausing of different programs and stuff. So this has been a very helpful kind of just supplemental resource for people. We also administered the SNAP Match program during the farmers market season, which allowed people to use their EBT benefits at the farmers market and then get matching dollars to purchase a fresh and local food. We also have, I don't have a picture of it, but we do also have free and very low barrier access to sexual and reproductive health related items like Plan B and condoms, pregnancy tests, and all of that's very confidential, and people can come in at any point to access that as well, which has a prevention lens, of course, to it. But it can be a huge relief in the moment for somebody to be able to come in and have access, including young people. So we'll go to the next slide now. We, beyond kind of our food access program, we kind of all the different indicators that are included in this basic needs for health and safety. Of all of the indicators, room one, I kind of went through and listed here the ones that room one addresses on a regular basis. So the freedom from trauma, violence, addiction, and crime, nutritious food, safe water, routine care for physical and mental health, and safe, satisfying sexuality and reproduction, and then sufficient sleep, which is often associated with a safe living, condition or shelter place that you're living. So I thought I would, to just kind of highlight our work, I thought I'd share two stories of how we've supported somebody with some of these basic needs. And I think, it also shows, the stories show how interconnected people's needs are with one another. I've changed some of the details and, changed names and all of that to ensure confidentiality and kind of de-identify them. But I think just the overall picture of these two examples really highlights, the importance of addressing basic needs in order for people to kind of reach the next thing that they want to work on in their life or have going on in their life. So I'll read these, it's just two paragraphs for these two different stories. So Maisie first came into room one 10 years ago. Initially, she came in asking for support with mental health after her PTSD was triggered from an assault. Over the years, room one has supported Maisie with many basic needs, health and safety needs. For a long time, Maisie had unstable with no running water or electricity, which allowed her to only shower once a month. Room one also supported Maisie with emergency food. She has needed financial support, paying her rent, and support with transportation to and from medical appointments. And after a lot of coordination between different agencies, Maisie has, in the last two years maybe, Maisie has been able to move into a newer, safer living situation with some additional in-home support. And when we see Maisie now, she has been able to take showers regularly. Her hair is all, washed and combed. She's safer and therefore she's sleeping better. And then she almost always has, just a cup of like hot tea that she's enjoying. So that's story number one. Story number two is Jason first came into room one in 2019. For the last 7 years, Jason has not lived in a home with running water or electricity, and he lives in an area where his things are frequently stolen. Jason has some disabilities that limit his ability to work. All of his identifying paperwork has been stolen. And because of this, he hasn't been able to access his Social Security disability benefits, or really apply for any other kind of benefits like food benefits or even new housing. He has no phone and no access to reliable transportation. And so Room One has helped Jason navigate, various systems in order to get some of those documents, those identifying documents back, and has also helped Jason make calls to schedule regular medical appointments for primary care. So I think those are the two stories. I think one thing we often find is that when there are just additional barriers, people often, like transportation, paperwork, identification, just geographical location of where they live, etc. Primary, or just any kind of medical care or mental health for that matter, it makes it really hard to access those things. So people often come in and just like use our phone to make appointments, or the clinic will call us and then we can help set up transportation. But we kind of moving into the next part here, which is about partnerships. I just, want to echo, how critical partnerships are for working in a rural context. So we've got a few pictures here. One is with Methow at home, which I think Selena is on the call, as Selena is the executive director of Methow at home. So we really appreciate working with them. The other picture is of Blue Sky Mines with some food that they gleaned that then we have handed out to community members. And I think Blue Sky Mines presented at a different listening session, which is really cool. So the fact is that in our rural area, the challenges that people face are so complex that there just is simply no way that we can work in isolation from each other, and partnerships are just critical. So I was also, just like Derek mentioned, I was also going to mention real briefly the Methow Valley Elder Care Coordination Network, which is funded by the Health Resource and Services Administration, which is specifically for people who are age 65 and older. That recently that network launched the implementation of a new care coordination platform. And so with the patient's consent, we can then very easily speak with somebody from Aero Methow, somebody from Methow at home, somebody from Jamie's place, somebody from any number of the hospitals or the clinics here nearby, to really coordinate the care well for that person. And just yesterday, I was talking with one of our advocates who has a client, and who is part of this network and has given consent for us. to coordinate together with other providers. And she just has said it's made the most tremendous impact for this person. And it's very clear that no single agency would have been able to individually support this person in with their kind of unique circumstance and background. And so everybody, all the kind of agencies are able to contribute in our areas, different areas of support and expertise. And then it also allows us to support one another, which makes our work much more sustainable in the end. So I think, the more we can have integrated community systems, across the lifespan and various needs, the better off we're going to be able to, or the healthier our communities are going to be, really, is what it comes down to. And so that is, partnerships are just a big part of what we, of our work and how we can just serve our community. And so I think that the final slide here, is just an invitation. If there are opportunities that you know of or can think of to collaborate or share ideas, if you live in a different rural area and something has worked well for you all, please don't hesitate to reach out with us. We always want to learn and improve, what we can offer and how we walk alongside the people in our community. So thank you.
Thank you, Kat. That was amazing. Truly enjoyed the stories, and I think it's really speaks to the meaningful work and wealth that, helping your community members in that way. So thank you for that. All right. So last and not least, we will hear from Stefani with Thrive Chelan Valley. Thrive Chelan's Valley work focuses on youth and families in the Lake Chelan area. Her organization's program shows us how meeting basic needs, including food, clothing, hygiene, mentorship, and safe spaces, creates stability and belonging, especially during critical developmental years. As you listen, consider how prevention, youth empowerment and development, and basic needs are deeply connected. Thank you for joining us, Stefani.
Thank you for having me. That was so great to hear from the other organizations. I feel like a lot of the things that we've implemented, we got ideas from other nonprofits in the area. So it's always good to hear what's going on outside of our valley. My name's Stefani Morgan. I'm the executive director for Thrive. I've been with Thrive for about 8 years. I started out volunteering with them when I worked over at the high school. And then I was program director for a couple of years, and then I've been in this position for a couple of years now. What I'm going to go over today is just our mission and vision, the history of Thrive, because it's one of the things I love most about it, the basic needs that I feel like our nonprofit addresses, the 3 programs that help us address those basic needs, the volunteer training, and then just some ideas if you're wanting to implement any of the things that we talk about today. Our mission is to serve, empower, and advocate for all Lake Chelan Valley youth. And our vision is that all Chelan and Manson students would have everything they need to reach their full potential. Our history, every part of our programs were started by community members in the Chelan Valley. So the first one was our Chelan Teen Center back in 1999. It was a group of community members, teachers, people from churches, and the city who got together and decided that our students needed a space after school to work on homework and have snacks and be with some healthy adults. Our CARES program was a group of parents who realized there were friends of their kids who weren't participating in maybe sports or clubs because they didn't have what they needed to do that. So they started raising money on their own. They went under another nonprofit at that time. And that's how that one got started. They did athletic gear and food and all sorts of different things. And then the mentoring was started by a teacher at Chelan High School. It ended up working into kind of a classroom. They had a combination of student mentoring and one-to-one mentoring with adults. And then in 2013, these three organizations realized they were all serving youth and they could maybe do that better together. And that's when Thrive was born. Real quick before this, our funding, I love that you guys did that because it just kind of helps other nonprofits know maybe where they can get help with those things. So we are locally based. All of our funding is divided about into thirds. A third of it would be like our monthly and one-time donors. A third of it is fundraising events that we put on, and then a third of it is grants like the Vital Conditions grant. The basic needs that we help address through the three programs are clothing, food, hygiene items, meals, healthy relationships for students, learning life skills, different relaxation and mental health techniques, and our volunteer training helps with that. The first program I'm going to go over is our CARES program. And that one we do, the first thing is on our website, we have a CARES form, and that can be filled out by, it's usually filled out by school staff, but it can be filled out by mentors or community members. And they just go on and fill out a quick thing that says, this is the student, this is what they need. These are the places they've reached out to, and can we help? And like the other ones, there isn't any requirement for need. We figure if they're asking, then they need it. So they don't have to show any proof of needing it. And then our goal is within 24 to 48 hours to get that to them. We have CARES shoppers all across the valley. So if I get a CARES request for snow boots, which is hard to find in Chelan in March, and somebody's going to Wenatchee, they'll run to Wenatchee and grab the boots and bring them back for the student. Um, but that ranges like you guys to all sorts of things. We don't really have any limits if it's a basic need, a safety issue, or a barrier to the education, and we have the funds to do it, then we'll take care of it. We do weekend meal bags through our CARES program. We do 187 every Friday. In the valley, we do 40 out to Manson and 147 in Chelan. Those are provided by Second Harvest in Spokane. So we get a shipment, which will happen this next Monday, once a month. And we got storage space from Lake Chelan School District to store all those weekend meal bags. And then we have volunteers that run that program. So they come in and count out the bags for each of the different counselors. We try to do it in the most respectful way possible. So we communicate with the counselors. They don't let us know names, just numbers. And so we give them that many bags and then they hand them out to the students to take home. We do a back to school fair through our CARES program every year. We serve about 400 kids each year in the valley, and then we welcome, of course, kids in the little communities outside of that. We do backpacks filled with school supplies is the basic part of it. And then we try to have, we have a group, a church that does some fun activities, some bouncy houses and face painting. And then we have resource booths. So beyond the back to school fair, families know where to get the resources after the event. Every year we've added some different things. So we added several years ago free haircuts. We get different barbers and hairstylists that will donate their time. And we have a room that's just full of salon chairs and mirrors, and it's fun to see. And then we added a couple years ago sports physicals, so families can get those done while they're at the fair too. So we're always just kind of brainstorming what families need to start the year, right? And that happens in August every year. So we started a few years ago. We had a senior come to us about doing a prom dress giveaway. So we started that, and it's been amazing for people to have a place to donate those old dresses. And we've got over 200 dresses. We've just been doing it for prom because we have to tear down and set up every year. But we actually just got a space donated in the basement of a downtown shop. So we've been fixing it up over the last month, and now we'll leave it there and we'll be able to collect menswear, formal wear, and we're also going to collect professional wear there too because we get requests for clubs or job interviews. So this way, students will have a place to get it. And then we had another group ask us to take over Manger Mall, which is helping with Christmas gifts every year. And that's been around for decades, run by different groups. And we will take it over in 2026. And it serves about 700 kids, is what they got last year. So we're excited about that. Our teen center, so our Chelan one has been around since 1999. We opened one in Manson in 2024. They both operate out of United Methodist Church spaces that are donated to us. That they had basement spaces that weren't being used, and so we've been able to help. We can run our programs, and then they feel glad that the spaces are being used. So it's nice to have those community relationships. At both teen centers, we have clothing closets and hygiene closets. We serve a meal every time we're open. Um, we, I think we of course have volunteers. A lot of our volunteers are actually retired teachers or people that worked with kids in some way, and so they come in and donate their time. So we do that, and then we've got pool tables and um, air hockey, arts and crafts things. And then we try to have something that we're teaching them each time. So like this Friday, we got a wood burning kit that will be set up at the Manson Teen Center and we'll teach kids how to do that. So we try to have something fun that draws them in and that they can learn something new. Yeah. Our last program is our mentoring program. It's one-to-one mentoring. It's historically been with middle school and high school students. And we are growing that this year. We're kind of upping our resources for those mentors before we really go out and grow it. But we're hoping to go down to third grade and then go up through college and young adulthood. My first year in here, when I went to give a graduation gift and the closure letter for their mentoring relationship at the same time, it felt really strange to me because that's the time in your life when you're about to make some of the biggest decisions of your life and sometimes on your own. And so it just felt better to us to have those relationships continue. I mean, they usually do unofficially, anyways. My mentees are both in their 20s and we still keep in touch. But this way, they'd have
Mhm.
the backing of Thrive, right? They can ask us for help with things as they're going through those times. This is a student-driven program, so these student our students coming to us saying they would like a mentor. We do quarterly events for these. We just had a painting class at the Vogue here in town. We've done the ropes course, the climbing place in Wenatchee. We try to think of it's either something the students haven't tried or kind of a bonding experience for the two of them. For our volunteer training, we feel like especially working with youth, and because we have one full-time staff member and one part-time staff member, and that's how all these are run. So we of course have 102 volunteers that help us run these programs. So we feel like it's really important to make sure they're trained, especially working with youth. So we have 4 trainings every year. One of them is mandatory, and that's where we go over kind of our most important things we feel like they should know. And then we have 3 optional ones. Um, the mandatory one, since it's mandatory, is offered in person and via Zoom. The other ones are just in person because we feel like those personal conversations where you can talk about details and not have it recorded or out there is valuable. So we go over things like ACEs. A lot of the kids we work with have high ACE scores. We talk about suicide ideation. We have a couple school counselors that come in and help us with QPR training, and lots of other stuff. Um, I wanted to, like I said before, a lot of the things that we do are ideas that we got from other nonprofits. So when I first started and I was program director, I went with the ED to visit fire in the Omak Okanagan area, and which is an amazing space if you haven't been. Um, and one of the things we saw was that they had a clothing room. And we thought, oh, we could do this. But our teen center spaces, their basements of very old buildings, some of the oldest in the valley. Um, so it's limited space that we have. So we thought, well, if we could start with just a closet. And so that's what we did in Chelan. We had this space that was used for storage of extra items and food and things that, for future use that we could take somewhere else. And we opened that up and put in some racks and made a clothing closet. It started out, maybe a few $100s worth of items we'd be giving away. And now between our clothing and hygiene closets this last quarter, we gave away almost $6,000 worth of those things. So that to keep track of it helps us know whether we're making good use of the space, right? And this obviously was a resource that was needed, um, both the hygiene and the clothing. So that's what I would suggest. Like if you, and both of those are completely, mostly done by donations. Every once in a while, we have to fill in the hygiene stuff, right? The things that are used most, um, deodorant, shampoo, toothbrushes, we'll fill in if we run out, but we have a ton of community partners where they'll do hygiene drives or clothing drives, and then we get it and can fill those spaces back up again. Um, the weekend meal bags has been a huge support for students when they don't get those free meals from school. So it's filled with 2 breakfasts and 2 lunches and some snacks for Saturday and Sunday. That would be one that if we get those from Second Harvest, like I said, you could partner with other ones since they come over from Spokane, they really want a good amount. But if you partnered, you could do 50, another person could do 100, and just one of those resources that makes it easy to help with those basic needs. I think that's really all I had. This is my obviously much less than a half hour, but here's my contact info. And we love to show people our spaces. So if you want to see what they look like and get some ideas, you'd be more than welcome. We do some tours. Or if you just have questions about where we get our resources or funding, I'd be happy to chat. Always down for a cup of coffee.
Thank you so much, Stephanie, for that amazing overview. And thank you to all three of our presenters today. We greatly appreciate and value um, each and every one of your contributions, not only today as speakers in this learning session, but within the communities that you serve across the region. So next up, we have coordinated small group discussions. We would like you all to lean into these conversations and um, we're essentially asking where do you see these efforts already connected in the communities that you serve? Where are there shared challenges and where might coordination make things easier for organizations and for community members? I can tell some folks are dropping off, so might get intimidated with that small group discussion, but thank you for those that stay on and um, are willing to lean into these conversations. So just a reminder, you don't need to represent your entire organization or have fully formed ideas. Curiosity is enough. So please join the conversation and we'll see you back here in about 10 minutes. Thank you all for sticking around to the group dialogue. We greatly appreciate it. Um, all right, so I figured we can, maybe a few brave souls could come off mute and offer some insight into your guys' conversations. What did you hear from your fellow um, partners and colleagues?
Donnie, you want to tell him our group?
You have the mic, Teresa, so I will leave it up to you if you are so inclined.
We couldn't share the page on the breakout discussion, but we did collaborate on the different departments and the different areas that we work on, and everything just intersects. Everybody has something to bring to the table, and so I'm so glad that this opportunity is here for all of us to just be a part of. I could give my own I guess discussion information. So where do you see overlaps with your own organization and work? We do have a number of organizations that do work with children, low income, food supplement, and I do see a lot of I don't want to say waste, but need for maybe more structure so that, if somebody's giving out or supplying a certain kind of assistance, it's not duplicated elsewhere. Does that make sense? And sometimes it's different, but it's almost the same. So,
Mm.
like maybe with food, a lot of the kids get the same type of food versus, you know, um, more options that they could get, and supplies again for hygiene and stuff. It's kind of the same things. There's a lot of children I've seen out there, or even adults that have eczema or psoriasis, and so some of those things could probably be touched on, with different skin issues or allergies. Um, what does it look like if these services were fully coordinated across the region? We have so many children and families that move often because they're not in stable homes. So just moving to a different part of Grant County, just having that love of fellowship where someone follows them and goes, hey, this is the person that's going to be on the other side that you can talk to, would be just a blessing, because it's almost like holding their hand and going, we're not leaving you, we're just going to pass you off to who's in your new area. And then where do you see the strongest opportunities to cross sector? I think it's the same thing. When we collaborate and someone says, hey, I'm moving to Wenatchee, and we know, I know Donnie in Wenatchee, you can reach out to him, or, anybody else across the um, boundaries, just having that collaboration and being able to talk about a family that was maybe here in Moses Lake and they had probably, left to go to another area. Just having that, collaboration together would help their journey at least. And ours, I guess, right? Because we have all the information on them. So to be able to share their stories with others. I'm done talking. Thank you.
Thank you, Teresa. That was great. Does anybody else want to share maybe how they're seeing their work overlapping with some of the organizations that shared today?
Lindsay, would you want to share your library example? Because I thought what was interesting in our breakout groups, we had an organization that really served children and families, and then an organization that really serves elders and those aging in place. And we were looking for where are the opportunities for intergenerational programming.
Yeah. So yeah, we kind of represented opposite ends of the life spectrum there, but I think both organizations have been looking for ways to offer intergenerational connections. So we have a local library here, and they offer a lot of programming that appeals to all ages. So they have a card making workshop series that's been popular, and you'll see everything from 5-year-olds to 80-year-olds show up for that event. And I know they're going to have one on making like a bee hotel to support local bees. And that will appeal again. And the way it's marketed as well, it doesn't necessarily indicate an age. So you just find that all ages show up to those events. So that was really nice to see. Yeah.
Thank you. Well, what I'm hearing is exactly, why this framework matters. No one organization holds the whole condition, but together we start to see the system, the gaps, and the opportunities for alignment. Uh, Teresa, this certainly resonated and stood out for me from what you shared, is that, many of the opportunities named don't require entirely new programs. They start with stronger connections, shared understanding, and just clear pathways between, opportunities and assets that already exist. So thank you all for sharing and for entering into dialogue with one another. Sarah, do you mind going into the next question or the next slide? Great. So just as we wrap things up and enter into some reflection time, I'd like to also invite any brave souls to come off mute and maybe share something that stood out from today's conversation, whether it's a particular story shared or a resource, opportunity that's being offered that you maybe did not know about. And perhaps what's one idea or action that you're leaving with today, even if it's emailing somebody that you met and connected with in a breakout room. We like to know that these learning sessions are of value to you and that those that also present and share about their programs and their organizations are being heard as well. So if anybody would like to come off mute just to share these couple of items, that would be amazing.
I really liked how Thrive Chelan was talking about the clothing closet starting really small. I think sometimes when you see a need, you want to like jump in and get this program going and find funding for it. But I just appreciated that they just cleaned out a space, even if it was really tiny, utilized it, and then let the program grow from there. I thought that was a great example of trying to meet the needs of your community as you saw them arise in that moment. So,
Veronica, I was just really impressed with just thinking about the numbers of volunteers who are stepping in to help organizations throughout North Central Washington. And I know that there was quite a dip in volunteerism, generally speaking, through COVID, but it's encouraging to hear that there's so many people still passionate about helping others.
Indeed. Thank you, Derek.
We're going to, after this, I think, meet with Cafe because there's a lot of people that they get from the Chelan area. And so it'll be good for them to know kind of the resources that are available. And then I love the idea and have always thought of trying to cross like our senior center nonprofit program with us. And so I love the idea of putting on events that anybody could go to. So I think maybe that's where we'll start.
Yes, intergenerational opportunities and learning. I think that's amazing. I'd certainly love to learn more once you get the ball rolling on any event, Stephanie. Kelly, I see your hand is up.
Yeah, I was thinking about what Stephanie shared about Second Harvest coming out from Spokane with those weekend sounded like with those weekend snack bags for kiddos, and that strikes me as something I know we've utilized that up in the Okanagan, like with a diaper exchange where someone was driving out from Spokane and there was no way that our small organization could use all the resources, but there could be kind of a network of distribution as they drove out. We've done that with Upper Valley Mend as well in their gleaning program that Kat highlighted there at Room 1. So I'm just curious. I think that can be a strength of this regional network of if there's somebody coming out this way with resources, how do we get that distributed a little more broadly? So we'd love to be able to jump in on that one.
Amazing. Anybody else would like to share anything that stood out from today's conversations, either in the large group or small breakouts? All right.
I kind of entered a little later. Is there, are we going to be able to share information so we can collaborate down the line? Would that be possible? Just who was here and what group they're with?
Yeah, Teresa. So we will have, and I will jump into this as we wrap up the learning session, but we will have a learning session report that covers the speakers and any resources that were shared. But if there is something that you'd like to share with the broader network, feel free to email it to me directly, and I can certainly include that in our next mid-month newsletter coming out mid-March. Thank you for asking. All right. So thank you all for that beautiful reflection. I certainly think that today's session has shown us that basic needs for health and safety, aren't delivered by one program or just one sector. They're held collectively through relationships, coordination, and trust. And today was just one snapshot of basic needs for health and safety across the region. We heard what we heard reinforces that this condition is foundational and deeply interconnected with the other 6 vital conditions. And we hope that these sessions continue to build shared understanding, to spark relationships, and support more coordinated action over time. Sarah, can we take it to the next slide so we can wrap things up? All right, so I'd like to offer a quick network update. If you joined our summit last year, this picture will be familiar to you. On the stage are our 3 regional CHI leads. We have Ruben from Our Valley, Our Future, our Chelan Douglas CHI here to the left. Sitting next to him is Ryan from the Grant County CHI. And then fourth to last, we have Kelly from our Okanagan CHI is also here on today's call. Our local CHIs have been doing great planning to convene their local partners on their own local CHI priorities. So just a quick recap on what's happening in each of the particular regions. So the Chelan Douglas CHI, or Our Valley, Our Future, is holding its first symposium on March 19th with the focus on early learning. And I'll add that registration here in the chat for anybody that is interested. The Grant CHI is serving as the convening partner for the Grant County Community Health Improvement Plan. They will also be hosting their first convening in March. And you can visit their website. I'll add that to the chat as well, or contact Ryan if you have any questions. And then last but not least, our Okanagan CHI will be hosting their second meeting of the year. That will be in person, March 26th from noon to 1:30. And you can email Kelly. I'll include her email in the chat as well. If you have any questions on how to get involved with the Okanagan CHI. Next slide, Sarah. Thank you. So we will continue this learning series with other vital conditions throughout the year. We have confirmed sessions on a bi-monthly basis, and you can find those registration links on our website under events for each of these dates. As we confirm speakers, we will share more about them in our upcoming newsletter, so please stay tuned. And please save the date for October 21st. We will be hosting our 3rd annual summit in Moses Lake this year, so more details to come, including registration on that. Next slide. So this concludes our time together. We will have a learning session report, as I was mentioning earlier, on our website soon, which will include today's recording, today's slide deck, and other resources, data, and information. I also welcome you to visit last year's learning sessions available on our website if you missed those from last year. We had pretty amazing topics as well, including a tribal learning journey, thriving natural world, and belonging and civic muscle. If you joined Monday's Regional Food Council meeting hosted by Maria Hines and are hungry to learn more about food as a multi-solver, that was also one of our topics last year. So I'll include the link in the chat as well for our 2025 learning series if you'd like to go back and learn more about what we offered last year. Thank you once again to our speakers, Kat, Stephanie, and Derek for joining us today and contributing your time and efforts. And thank you all for your time and commitment to joining us on our first learning session of the year. Have a great one, everyone.
Thanks for hosting.
Thank you,
Kelly.
Veronica. Bye.
Thank you.